So for the meantime, I will provide you this call bell. If you need me, just press on this button. I will gather now the material needed for the wound dressing. Would that be okay?
Okay.
All right. So, Assessor, can you please confirm to me that this trolley has been cleaned with soap and water, Clinell Wipe, and ready to use?
Yes.
Okay, so for the purposes of the exam, I need to wear clean gloves and make sure to clean this with Clinell wipes. So I need to wipe this trolley with one Clinell wipe from top to bottom in an S motion, including the sides and the poles as well. Then discard into the orange bin. Then I need to get another Clinell wipe. I need to clean it in the same manner, that's farthest and nearest in an S motion, including the sides. And then the poles. And then I'm going to dispose this into the orange bin. I will remove my clean gloves, do my hand rub now, using the 7 steps, and then I can then start gathering my materials. So I have my wound dressing pack. It's sterile, intact, and it expires on 2025 of June. I need my saline solution. This is sterile, intact, and it expires on 2022 of March. And I will place them at the bottom of my trolley. I will need my offsite dressing since the patient is allergic to Meepor. This is sterile, it's intact, and it expires on 2025 of April. I will need my hand rub. And so I will now wear my apron and clean gloves before approaching the patient. And then I need to hold this trolley towards the patient while only touching the poles. So, hi Daisy, I am back. Are you happy now to proceed with the wound dressing?
Yes.
So I'll just move this to the side. So I may need to expose your side. Would that be okay?
Okay.
So could you tell me where your wound is?
It's on my left shoulder.
Okay, so can I expose your left shoulder then? That's okay?
Okay.
Okay, thank you. So I can see that your wound is dry, it's intact. It doesn't show any signs of infection or inflammation. There's no redness, there's no pus or swelling. Okay, so can I loosen this dressing?
Okay.
Okay. So, is it painful? I do apologize if it's painful. I'm just gonna loosen this dressing. Just on the sides, okay?
Okay.
Alright, so what I need to do now is I have to start opening my materials. I'll remove this clean gloves, do a hand rub using the 7 steps, and then I'm gonna start opening my stuff. So I'll open this now. Yeah. I'll throw this into the bin or maybe the places underneath. So I'll do another hand rub. So with only touching the tips of the corners, I need to open this like that. And then I need to open this one as well. So I need to make sure I support both sides so that it won't fold back in. Then what I do now, is to open this part. So support this so that it won't fold back in. Then lastly is this one. So what I do is support this again. So I need to make sure that I'm only touching the tips of the corners. So what I do now, is do another hand rub. I need to get this orange bag. So this orange bag, it has a stripe. I need to make sure to only touch this middle part and nowhere else. I need to give it a tap. And then I need to find this area here where I could insert my hand. So I'll insert my hand here. I would crumple this part so that it's not flying. Then I will twist this around so that it will not be flying all over the place. And I will use this as a sterile kind of hand to arrange my field. So I need to make sure and check that and assume that I have a 1-inch like unsterile area of my field. So this one, I can actually crumple this because this is a bit difficult to remove. And so with my gloves, I need to make sure I know where the right side and left as well. So that's it. I'll move this a bit further there. I should know where my left and right is. And then I need to move the drapes. And then I will now I'm now happy with the arrangement of my field. I need to grab the old dressing then. So I'm gonna try to grab the old dressing. I'm sorry if it's too painful. Okay, thank you. So I will now invert this orange bag and make this as my bin bag, my clinical waste bag. I need to remove this sticky bit. So that part. And I will stick this near the side of the patient. So if I can place it there and move that just like that. Okay. I will throw this into the garbage bin. I will then do another hand rub using 7 steps. I will to get my Clinell wipes. So I need to have my alcohol swab, and then I'll open it. And then I will need to disinfect the neck or the mouth of my ampule. Disinfect it for 30 seconds, let it dry for 30 seconds. Open it, and then pour it into my small galley pot. Making sure not to splash all over. Then I can throw this there. And then I can open my dressing, my offsite dressing, since patient is allergic to me for dressing. And after that, I'll throw this here. I'll try to make sure that this bag is expanded for easy of use. Do another hand rub. Then I'm gonna wear my gloves now. I need to make sure when I pick up my gloves, I actually would know which one is the right side and the left side. So I'll pick this up from the middle. Then insert my finger there to expand. Then try to find my way through. Making sure I don't touch that part. Then the next one, I insert my other hand into the cuff, making sure I know where my thumb is, the thumb part is. So with using an open gloving method, I'll insert again my hand, expand this part, then pull it. Then you can adjust your glove. So with this, I need to employ a clean and dirty hand technique. So clean hand will be the hand touching the field, and the dirty hand will be the one touching the patient. So I need to get a drape. And then what I need to do is place a drape just underneath the wound, making sure I don't contaminate my hands with the patient's linen. And I'll get another one. To just place that on the chest there. So I need to ensure that my hands are sterile. So what I need to do now is employ a clean and dirty hand technique. So I'll pick one swab with my clean hand, dip it into saline, squeeze it, then pass it to the other hand without the hands touching each other. Then wipe the wound in a single stroke. Then drop it into the orange bin. Get another one. Dip it into saline, squeeze it. Without touching the other hand, pass it to the dirty hand. Give it a wipe with a one-stroke motion, and then drop it. Then lastly, get another one. Pass it to the other hand. Dab it dry. Give it a dab, then throw it into the bin. Then with the clean hand again, pick up the dressing. Then you can use both hands then to place the dressing over the wound. Then just remove the sticky parts. And then I can remove the drape. So Daisy, I'm now done with the procedure. So I'm just gonna dispose of this now into my orange bin, mechanical waste bin here. And I need to clean this trolley with Clinell wipes. So I just need to dispose of this. My apron. And then I need to cover you back to provide privacy. I need to remove my clean gloves and do a hand rub. So Daisy, I'm now done with the procedure. I need to document this now. I need to document the date, the time, and the dressing that was used, the solution that I used for cleaning, and then with my name, date, and signature as well. What else? I need to document that there were no signs of infection or inflammation, no redness, no pus, no swelling, and I would suggest that you increase your intake of protein so that it will help and hasten your wound healing. I'll refer you to your dietitian for this as well. Would that be okay?
Okay.
Okay, so I will now leave the room. If you need me, I have this call bell. And I'm done with the procedure. I'm happy to leave the room.